This is an informational video directed at athletic trainers on how to properly identify and treat a heel contusion. A heel contusion happens when there is a blunt force trauma to the heel or repetitive impacts from long distance running or jumping. These are very common in cross-country runners, basketball players, and volleyball players. However, like any injury, this can happen from any sport. A heel contusion can be identified from pain upon pressure and swelling on or around the heel area. There are multiple severities, from a bruise on the skin, which is a mild one, to a calcaneus fracture, which is a severe injury. Based on the severity of the injury, the athlete may need to see a doctor for further x-rays. Now, in treating a heel contusion, the goal is to increase the amount of padding on the skin over the injury. So, you're going to just use the athletic tape, and when you're taping, you're going to be wanting to weave the tape over the heel. You're going to start from the outside of the heel and just work inward. So you're going to start on the back side of the heel, not directly over the heel, but just around the Achilles tendon, and you're going to go over and just continue to tear at the side there. So the tape's going to end right there, and the next one will start at the exact same spot on the other side and will end at the same spot on the other side. So you're just going to start by surrounding the heel with the tape, and then from there just weaving the tape over. So you're going to start one on the top and one on the bottom and just continue to do the same thing. This will compress the padding on the foot, which is over the heel, that protects the calcaneus from all of the impacts. And when you're weaving it, that'll just make the tape stronger and less likely to move around while the athlete's in play. Now, based on the severity of the injury, the athlete will have different recovery times. For a mild injury, they will just have to have their ankle or their heel taped, but with a mild one, just a skin bruise, they're still going to be able to play, whereas a fracture, depending on the severity of the fracture, could take several weeks to ever come back, or they might be out for the season. So as you see here, you're just going to keep taping from one side of the heel to the next, covering the entire heel as you go around, and you're just going to continue that weaving pattern until eventually you cover the entire heel. Make sure the tape is tight enough so it's actually being effective, but you don't want it to be too tight, whereas you're cutting off circulation from the player's blood flow, because they still need all the feeling in their foot, especially for when they're going to be exercising. So when you finally finish taping over that entire heel, you're going to end by going right across the back of the heel at the angle right there. And just like that, the full heel is taped, you have it all weaved, and that's how you treat a heel contusion. Obviously, there's going to be different possible casts if they do have a heel fracture, but for someone who's ready to go back into play soon, but still with the amount of injury, they can still just have the tape for when they're actually doing the playing. And that's a heel contusion.